I'm so late to that Amifaku. Is it Ami?
Ami Faku?
How do you say her name?
Ami. You're right.
Fagu.
Fagu.
Is she South African or she's Ghanaian?
I think she's
I always thought her name sounded Ghanaian.
It does. That was my last edit song that I liked. So how are you, chick?
Oh no, sorry. I think we have to start high energy.
Okay.
Beginning of the year, whatever. Sorry.
So you're better with the energy business.
No, you can.
I cannot. I can't. You are the energy.
What do you mean?
You are.
I got energy.
Bring the energy to the table.
Got too many energy. 2020, baby. Woo! New decade, new year, new me. Woo!
New Year, same me.
New Year, same me. Did you see that Lizzo thing?
Oh, which one?
Oh, there was like a GIF or something of Lizzo. You know the singer.
Yeah.
And then it was like new. It was like what was it? Like she was like dancing, and then like someone else comes on the stage, and it's like new me, and then like Lizzo like bumps her out, and it's like save me. And I was looking at that, I was like, oh my god, this is so me. Like midway through January,
you're like exhausted.
I'm like, I'm so tired of being a better person.
But January has actually gone by a little bit quick.
Reckon?
I can't believe that it's like the going into our early 20s, like already, like
yeah. I feel like for me it's gone quick just because like
you're busy.
Yeah, I'm busy.
Africa summiting.
Yeah, like I've been busy and like focusing on things. I think that's kind of like what's made it kind of go a little bit quickly.
Do you say quickie or quickly?
When I do not it's a new decade. You don't want to be a better person.
I am a better person.
Everyone is working to be a better person. And
I didn't hear what you said. Did you say quick? I need to listen to this.
Quickly.
So why didn't you say it properly? Why do you not enunciate your words?
Quickly.
Okay, that's good. This is a confused person. Come on, this is my accents.
No. So, okay. So, Happy New Year.
Happy New Year.
I actually have not seen you this year. Yeah.
And it's the 20-something. Crazy.
I have not seen you. So, okay, what is one thing that you had wanted to do in 2020? Maybe like a New Year's resolution or whatever you call it for yourself, like a goal that you have maintained like so far. And then one that you either have not been able to maintain, or as the new year has gone on, you've kind of thought, maybe not.
That's really tricky because I feel like it's still quite early on. So you can't, in order to develop a habit, they say you have to do something 20.
No, but what is it that maybe you think you have been where you can see a trajectory? It's okay. No, I'm really trying in this area.
Do you know, like? It's difficult for me to say. I think one thing I want to try and do more of instead of texting is to be having at least because I am a texter. Is to have at least one meaningful conversation a day with somebody. Not a day, but do you know what I mean? For me, that's a big thing because I hide behind messages,
right?
So that's what I want to try and do.
Have you attempted?
I have, yeah.
Okay.
So I think I'm getting there.
Okay. What's one thing that you haven't been able to, either because you tried and you just haven't been able to, or maybe you either rethought about it and you're like, oh, actually, why did I have that as a goal?
I guess maybe before I moved, I was running like outside. So when I moved to the place I'm at now, I was like, I will run a bit more.
Yeah.
But I haven't been able to do that just due to the weather. Yeah. And it's also very hilly there.
Yeah.
Like no joke. So how about you?
So one thing one thing that I've maintained is I've wanted to get more sleep.
Okay.
Like I've been so bad with my sleeping. Yeah. Like I'm the type of person that just goes on 3 hours, 4 hours sleep. Yeah. But then I was like, you know what? We're now in our 30s, girls. Yeah. So, And I think it's something that I have tried. Not every day, but I do think on average, I probably am now getting like at least 6+ hours, which for me is
a lot.
Huge.
Yeah.
And it's taken discipline
to get
of literally being like trying to
done.
At 10, put my phone down. Or what I try and now do is go to bed a little bit earlier. Because what I've realized with me is I'll go to bed at 10:30, but I'll be on my phone till like midnight.
Yeah.
Then I don't sleep. But so for me, and I'll be honest with you, I have felt
a difference.
Yeah, like
That's
I've
really
felt like the difference of sleeping. I'm like, oh my God, like I can't believe the joys of sleeping.
Oh my gosh, I love sleeping so much.
Yeah,
food and sleep. Yeah.
Like, and actually I wake up and I feel refreshed.
Fresh.
And there is this page on Instagram that I've been following, which is called the Nap Ministry. And their whole thing is like just promoting rest and trying to like push back against this grind culture, like, no sleep and all that. And I looked at that, and first of all, I guess I kind of took it as a joke, but I've really kind of been like internalizing it, like, what, rest, because I think even with New Year's resolutions for me, I was kind of like, oh my God, I need to do this, and I actually haven't finished doing like my goal, because I was trying to do like a long term, like 2-3 year goal, and I was like, what, I need to rest, and then I can finish my goals in at the end of the month or whatever.
So
that's one.
No, that's good. You said okay.
Another that I haven't been able to maintain. Okay, no. So it's not that I haven't been able. It's I've rethought. It's to do with this whole like cutting people off.
Okay, tell me more.
Like, okay. Anyway, this will be a topic for another day.
Okay.
It's kind of like I've, for various reasons, there's some people that will be like, oh, you know what, I'm gonna put them on ice or whatever, and for reasons that are okay and make sense, right? But then I've kind of been rethinking it in the sense that sometimes you kind of just need to go through the process. Like, it's a bit hard to just say, oh, I'm cutting someone off and just cut them off like that.
Okay.
No, but what I'm saying is also I was thinking, because someone did that to me. Well, not did that to me, but kind of threatened to cut me off, and it cut me deep, like more than I realized. And I actually thought, okay, I think maybe communicating, cutting off is not. Maybe you'd rather just pull away, but not be saying to someone, oh, I'm gonna not talk to you. So I kind of rethought that, maybe because I was at the brunt of it, where someone was kind of like, oh, if you don't want to talk to me or cut me off, whatever. And I was just like, this ain't cool. Like,
anyway, I think this is a topic for depth into
so
this
it's
one,
something I've rethought. Like, it's just more about, you can cut people off, but it's just more about maybe how you do it. Like, you don't need to be telling people I ain't gonna talk to you. Like, do you know what I mean? I think it's just, but it was because I maybe experienced it where they didn't say, like, they kind of threatened. And for me, my reaction was kind of like, oh, okay, I don't need that.
Okay.
So, yeah.
Okay. Well, we hear you. I think we need to actually set a whole episode aside for this one.
Yeah.
I think it'd be interesting to find out who. I'm just kidding.
No,
I'm just kidding.
Yeah.
No. So no, we need to talk about that at some point in regards to, because it's an element of protecting yourself and also just looking after yourself. And how
come every year people are protecting your peace? Every year you are protecting your peace.
Of course, because you are as in the person, are the most important person.
So but you can't be the same person all the time protecting your peace. You are the problem. No, I'm just saying, if every time you're like, I'm protecting my peace, I'm cutting people off, I'm protecting my peace.
Oh, right. I see what you mean.
Then it's just like the heck? No, I'm not with that.
Okay. No, we hear you. So,
Mm-hmm.
First episode of the decade.
Yes.
I don't know if we're even allowed to quit a decade.
It is a decade. It's a new decade.
Yeah.
To allow those woke people that are like, hey, it starts at 1. No, it starts now.
It
We're
starts
in a new
now.
decade.
Natasha has said.
Please.
Okay, so for this topic, for this episode today, we just want to talk a little bit or explore a little bit about how minorities, Black ethnic minorities, interact with the health system, and also just to take a closer look, just to really kind of peel up the layers in regards to how migrants interact with the healthcare facilities, because as we know, there's a lot of evidence that suggests that people who have been exposed to discrimination have poorer health outcomes. And I was reading something, and which I found really interesting, that it's even just the threat of discrimination predicts poor health, independent of the actual exposure. So you just walking around feeling like, oh, you know what, I might be discriminated against. That in itself, then somebody coming to discriminate against you, whether it's because of your color, your race, your religion, or whatever it is, that is an indicator of poorer health. And what we know as well is that people, whether you are people of color, we kind of expect to kind of be treated differently, expect to receive a poorer service. And this is like some research that actually found that it's called like everyday discrimination. And when you're walking around as a person of color, there's an element that you kind of protect yourself, that, I might experience some racial inequality, or I might experience, whether it's not, because it's interpersonal discrimination. It could be your race, it could be because of your age, because of your sex. But there is that element that we walk around with a protective layer around us, just to kind of protect ourselves from experiencing discrimination. And all those things are linked with poorer health outcomes. There is research that has shown that discrimination is linked with pathogenic processes in the body. So meaning that you are more prone to developing like some chronic conditions because we are being discriminated against. So I found that really interesting.
What's pathogenic?
So it's just how the cause of diseases.
Oh, okay.
So, so it's just the way diseases form, or the way diseases come to be. So it's just
Is that related to pathology?
In a way, yes.
Oh, okay.
So it's like it's at a cellular level.
Okay.
So how we know that discrimination leads to poorer health outcomes. We know that there is, for example, here in the UK, there was a group called Mothers and Babies, Reducing Life Through Audits and Confidential Inquiries. It was a group basically that was set up to look at why and what was happening with particularly Black women who were experiencing, they found that Black women were 5 times more likely to die as a direct result of childbirth compared to their counterparts. So they set up this inquiry, and they meant to find out what could they do to kind of reduce this from happening. And there's loads of other things. There's loads of other reasons for this. So it's multifactorial. So we know that it's due to racial and ethnic differences and receiving a difference in quality and also in the intensity of care. So that being said, we wanted to kind of bring it closer to home. It's like, how do you, because that's the wider thing.
Yeah. No, so interestingly enough, I've kind of been hearing this topic, right, about like basically how Black people, obviously we talked about like maternal deaths, and is it called maternal, like when you're giving birth and stuff. It actually kind of got me thinking about, like high profile stories that we've heard. We had that Mama Cax,
the Rihanna's model.
Yeah, because I heard something about concerns about that I think she was in London, and then she went to be seen. But it seems like people were kind of saying that, there was concerns that she was not taken seriously when she talked about her ailments. Even Kim Porter, P. Diddy's the mother of his kids, apparently she, and this is in America, that for a while she had been saying, you know, she's not feeling well, she's not feeling well, she's not feeling well, and unfortunately at the end, like, you know, she passed away. And also what we do know is that, I mean, I've heard like even Kelechi, who's like a podcaster and, you know, blogger and stuff like that here in the UK, like she's talked about like her experience.
Oh, really?
Yeah, when she
she's the one
had
with the baby.
Yeah, but previously she's publicly talked about like her miscarriage on the podcast and stuff like that, and she attributes that to the way that she was treated in hospital, and even, you know, like the report that you were saying that because they were saying that Black mothers are 5 times more likely to die during childbirth in comparison to white women. And actually even Asian women have a higher risk of dying in comparison to their white counterparts. There's even a blogger, I think she's here in the UK, called Candice Braithwaite. Like if you're into like mummy blogs and stuff like that, like she's big in that community, and she said that after she had her cesarean, like she complained that she felt really bad, right? And then they kept saying, no, this is like your first kid, don't worry and stuff like that. And then literally like hours later or days later, they took her to the theater and they were like, we need to treat you, otherwise you won't be with us in a few hours. Like it was that serious. And it's the constant thing of like Black people just not being taken seriously. Like, and we've seen stuff on social media where it's perceived that maybe our threshold for pain is much higher. And again, those are like the high profile stories that have been there, and just the big conversation that has been there just around, you know, how do minorities interact with the healthcare system, and particularly, you know, in the West where we are truly a minority, right? But then what we then wanted to focus on, because
I mean, just to bring it closer to home, it's really like what are the attitudes of people, of migrants accessing the healthcare system? You know, you're given like a 15-minute appointment, right? So bearing in mind that, you know, we are probably more at risk of carrying, you know, there's diseases that are linked with Black men, Black women, for example, are known to have high blood pressure, diabetes, etc., etc. And here in the UK, you're given like a 15-minute appointment. Yeah. And there's so many barriers to kind of how do you say what you are feeling in a 15-minute appointment, and bearing in mind that you need to kind of say what you want to say and also get feedback and also get a plan, have an outcome to say, okay, so this is what you need to do. Yet there are so many issues that we carry. So already, if we're walking around with what is perceived as everyday discrimination, you know, you're expecting that you're going to get treated differently. Yeah. You know?
And I thought that's why it was really interesting that we kind of started off with talking about basically, you know, what's being widely, how do I say the word?
Wildly.
No, like wide.
I know. Widely.
Yeah, talked about, right? But like, you know, as you said, we kind of wanted to like just take a closer look at, you know, what does this mean for migrants? Because what we're talking about is just generally like, you know, how do minorities, people of color interact with the healthcare systems in their countries in the West, right? But I've not seen anyone really talk about migrants exclusively.
Correct.
Because migrants are really like a subset of this wider circle. And I think that there are issues that are unique to us as migrants that don't affect the other people of color who are native to those countries.
Correct.
So it's good that you talk about, for example, like the 15 minutes. So if we can kind of like dig deep, like, can imagine you have the 15-minute, like what issues affect us as migrants, which make us more susceptible to, I guess, maybe being discriminated intentionally or unintentionally, which makes us not have the same good outcomes as other people would when they interact with the healthcare system.
I mean, I think for me, like the biggest thing that I have thought of is the language barrier. You know, I think it's, again, you know, there's so many subsets. There's subsets in that you can put all as Africans, you know, we will have different experiences from people out there, like from the Caribbeans, for example. So for us in particular, and personally, what I have seen is, I remember once, I must have been like, you know, before Form 2, I took my uncle asked me to take my great grandmother to the doctor. I remember sitting there, and he didn't speak Ndebele, and he was asking me, "Oh, what's happening with
who the doctor
with the cock?" Yeah.
Okay. Yeah.
And so I'm speaking. So I'm now the translator, isn't Uti? Okay, so this is happening, and need to go coco like Uti. What's the problem, right? And she was like, in this slabo. I was like, so I was like, slabo. I was like, what is that? Like, I was like, I think it's a stroke. And I was like, and even up until to this day, I still don't know what the closest thing to Islao is in English. So there's an element of language barriers. There's things that we have.
And that was Zim, man.
And that was Zim.
Imagine here.
So imagine here when you have to spend a good 5 minutes articulating that these are my symptoms. And what do you need to say in order to be taken seriously? Because I think as it is, there's going to be certain buzzwords in a doctor's lingo that is going to be like, okay, so this is serious. But as a person who doesn't have that language, who doesn't know what to say, I feel like that is where things get lost in translation and then things do not get taken seriously. So I think that's definitely one of the things. Like, I don't know if you have any thoughts in regards to...
Yeah. So I think language is definitely one. And I think I want to say that it's language in the most basic, like sometimes maybe English, you struggle with English, you know, because, you know, that's the language of transaction, right?
Yeah.
So I think there's that, but then there's another layer, which is just how we use language, right? The way we use our English is just different to how maybe English people use their English, right? So again, you talk about articulation, you talk about going to a GP and they literally be like, you only have 15 minutes, like stop waffling. Like, and you get there and the doctor's not even looking at you, probably like writing down notes, right? So you kind of have to be like succinct in what you're saying, like concise in what you're saying. And we you know, I know I struggle sometimes with being like like being brief and concise, right? So there's one. And then there's another thing, which is again related to how we use language, which is, I think, how can I articulate this? I don't know if sometimes it's just coming from just that positive language of faith, maybe maybe religiously induced or whatever, but which is almost minimizing, like, no, it's okay. It's not wanting to say, oh my God, like I feel so terrible, but kind of wanting to speak soften speak positively. And I think sometimes it's about, you know, acknowledging that maybe this is an environment where you should just actually say exactly what it is that you think, right? Because a doctor, nurse, healthcare professional will only really rely on what you tell them to be able to carry on further investigation. So I think that's one, language. I think another thing that I was thinking about is how can our attitudes to the healthcare system.
So like power, is you thinking like power balance?
No, so I was more so thinking about based on our experience. So for example, if you know, you're from Zim and in Zim, to to even go to a hospital or a doctor, it's something that you think money, and you think, or sometimes there may be mistrust. You be like, oh, I don't have money to go to the best, to the best hospital, to the best doctor, or I don't have money for. So you just stay at home, and you don't have trust of the healthcare system because you don't think it's functioning, right? So sometimes you can transpose those behaviors here, where even if you have a small ailment, you push through it because you going to a hospital doctor is not the first thing you sort of think of. So you bring those attitudes towards just the institution of healthcare here.
That's interesting. I always feel like, I almost feel like maybe because I work in healthcare, I find, I think it's the opposite. I think people actually might access it more. And you might find that someone will have umpteen appointments, but still trying to get one thing diagnosed. So again, back to that whole language thing. I think, as you were speaking earlier, I was thinking as well, like, back home, there's that element of respecting udokotela. Isikhathi sikadokotela. So you may end up not really articulating what you want. So then there's always that power balance, when you're udokotela phezulu kakhulu, and then you end up not saying, because you feel like, oh, you know what, I'm not, why am I even here? You feel like guilty, or you feel like a bit of a fraud to say that, I don't really, maybe my symptoms are not
as serious.
And then you end up downplaying them again.
Yeah. And then I think another thing, which I had sort of thought about under our attitude, but maybe this could be like a part A, B, or whatever. But I also think sometimes, like when you come here, I'm trying to think of myself, but I was young, so maybe I wasn't really thinking of it that way. But I do think sometimes maybe there's a feeling of like, feeling like you don't deserve the perks? Like, for example, in UK, healthcare is free. Like if you're registered with your GP and you live here, right? The National Health Service is free. You don't pay. So if you're coming from, that a culture where you pay for everything, you pay for a painkiller, you pay to to be seen or whatever, and then you come here and it's kind of like you be feeling like the kind of, it's more like, I don't know, it's like, is it like an inferiority complex imposter sort of thing where you feel like, oh, I don't deserve to access the healthcare system, and then put that together with the cocktail of maybe being in an environment where now there's like, you watch the news and there's like immigrants draining the healthcare system, or immigrants this.
What do you think it's like in South Africa? Like, in, with the whole xenophobic attacks and stuff, because that's another level of discrimination. Like, I think here, uthi ngazuhambe to A&E or GP, of course, there's an element of immigration status that is important, but you will get treated, and even if ungela like amaphepha, I think you still get treated, and then they bill you or something. Like, I'm thinking of people who are in transit, for example. But in South Africa, for example, that's a completely different ballgame. I have no experience whatsoever in regards to e-healthcare equally, but I'm wondering, like, what must that be like, where you are constantly walking around, you're being told you are there, people actively say that you are draining the healthcare system, you guys should go back. So it's harsher, it's and I'm sure it will be different for people who are again of a different standing, or people who are there legally, who are there, but what I just wonder how much more difficult it must be for people.
So I was talking to someone and they were saying it's quite complicated and quite layered, because again, it depends where you are. Because if you're in an affluent area,
then you're fine.
Just like as it is in like on the ground, right? Attitudes are different. And I think I saw something on YouTube where I think this was 2017 or 18, where they were saying like 18% of medical professionals are foreigners in South Africa.
Oh, really?
Or actually, I think it said we're Nigerians. I think, right?
Oh, really?
18%. So like that point was being made. So I think, and actually, there was a paper that I came across by this guy called by these two guys, one called Jonathan Crush and another called Godfrey Tawadzera, right? And they wrote a paper on they call it medical xenophobia, and particularly the Zimbabwean migrant access to public health services in South Africa, right? So their paper sort of examined the extent to which xenophobia manifests itself within public institutions that offer services to citizens and non-citizens. And their research was really primarily based on Zimbabweans and their experience. And I think it was done in Durban. That's where they did the research. And then they found that what they call medical xenophobia was deeply entrenched in the public health system and really dependent on the attitudes of the healthcare professionals. So again, why it's layered is because it's who's administering it, right? So if you've got a Zimbabwean doctor, you've got a Zimbabwean nurse, it will be different, right? Or maybe another immigrant, it will be different. And I think there's something, again, guys, maybe if you're in SA, you can advise. But my understanding was reading the paper was, I think there's something where like they have to treat you like, say if you're coming in and you're really unwell, it's over a certain threshold, like they have to treat you. But there were cases where people were being turned away.
Wow.
Because maybe they didn't have, like they were asking them for documentation or whatever. Yeah. But it's actually like, say for example, if you go somewhere and you know your blood pressure is falling, like everybody knows that that is serious, or your blood pressure is through the roof, like that is,
you have to get treated.
You need to treat someone who's coming with chest pains.
Care,
You know what I mean? So, but they found that people were being sort of turned away.
Wow.
So, yeah. So I actually,
Yeah, that's interesting. So I was reading something. So I love the way you came with your facts. But there's this paper, and I'll look for it. So it was basically a study that they did. This was in America, where they looked at, you know, when there's like a shooting, like when a black man gets, or sorry, not necessarily a man, black person gets shot down in a particular state. They found that, you know, that on its own, that one shooting would have a negative impact on people's health in that state for 3 months.
What?
For 3 months. So basically, it's crazy. But people, that affects the way people then will go to the doctors with problems, because they find that people, it's like, you know, they're carrying that that death with them, you know, and then it has a negative effect on their health and also how they interact with the healthcare system. Right. So I found that really fascinating. And also what you were talking about the person who is treating you. So that's the empathy gap, basically, is where we feel more sympathy or empathy towards people who are suffering from our own group as opposed to others. So that's like what you're saying with, you know, you go and you find there's a black nurse or a black doctor, you might find that you're treated differently. To flip that though, I remember when we were having this conversation and you were like, oh, you know what, if I go to the doctors, I would want, or to hospital, you'd want to be treated by somebody what did you say specifically? You said not West Africa.
Wow. So you're just gonna bab me up like that, right? No, I was okay. And this is non-PC. This is, you know, this is just my personal experience.
Yeah,
I have found that. Okay, I'm just gonna say it. Okay,
say it.
When I've had bad experience with healthcare, it really has been from people that other migrants, right?
Yeah.
In terms of maybe just being harsh in tone, or just not explaining things, or just because you're vulnerable, you know, when you go and stuff like that, and just not feeling a sense of like urgency and a sense of like with my and I was honest with you. I've said that for me. No, this is gonna sound bad.
No,
but
it's
for me,
not.
I'm like you. Every time I've really had like I've always had the best care, and I remember what I say to you, right? And again, no offense, I said to you, I totally think that, and I'll say this in that some of our people, right, are in healthcare because bafuna maphepha. That's not their calling. That's not their
100%.
passion, and they should be nowhere near a patient
100%,
at all.
Yeah.
And I've come across that, and I'm sorry.
I agree with you there. It's that, and then it totally knocks that whole empathy gap off the scale, because I think Utimina in Sekaya, for example, when I had to Tamara, that was a different experience of rehab. There was no empathy there, that's for sure. Like, you know, people or midwife, and that's the thing, or midwives are kind of known to have like a certain attitude to people giving birth. They're not as gentle as you're saying, you know, and I experienced that.
Really.
And then, you know, to flip the page and come here, for example, in the UK, you're right in that all my healthcare professionals, they came into it because of the safety of Amapepa, right?
Yeah.
So you find that, and it's not even just Abantu Abamnyama, even Amakiwa, because remember when there was a financial crisis, I remember we started having Tina saying qualified, you'd find that our students who are coming for my placement, kungabantu abadala, you know, umuntu accounting, for example, all of a sudden, like, because that was the security, people being made redundant. So now you have like a bunch of people who don't necessarily have the empathy or the compassion to be in healthcare. But they are the people who are now treating
and remember, I qualified and I say to you that I have seen a difference within. I'm not going to count, you know, you guys who came Libangan and you trained here, right? But say maybe people came a little bit older. But there's a difference between people, say, at home who were nurses or doctors versus people who came here and like did it for, you know, like, so those people, like, you can balobu, you know, like there's just that care, because I feel like it's a calling, right? Because I don't think I could do it.
I don't know about it being a calling, to be honest.
I mean,
I think you could do it.
I would.
If there was, you know, if it was a case of you, Natasha Yenzalapa, utola mapepako,
yeah. Maybe I was just never in that position, right? But I'm just saying, I every time I go to hospital, I come out and I say, God bless these people who work with, like, I'm always like, God bless you. You know. So,
and speaking of God as well, because that's another element, that's another angle. Of, you know, I guess people not really going to Oto in time. When they have izilingo, basically. Because, you know, the first place, the first point of call is to uhamba pastor, to get mtandas, or you know, to pray yourself, to fast. And yet my ailments are continuing to progress. So that's another reason why people take a little bit longer to go. And then when they do go to the symptoms or whatever
and that's the thing, so like religious purposes and relying on and those things, you know, they do work, but sometimes I think they are less effective in acute and very serious cases.
Of course.
Right?
Yeah.
So we all know that late diagnosis of anything, right, just puts you at such a high risk for so many things. And that's why if we go back to the attitude towards the healthcare system, because like I remember I was talking to someone and they were saying that, like Amacure, they catch things early. But just because they just have that, like if they feel whatever, they'll go to, and obviously, like say we face other things where, are you going to be believed or whatever, but they will go. Whereas think about the times where you've struggled through something and you became well, your body just healed you maybe in weeks, but you actually just carried it. You literally just carry. I know, like there's so many times literally carried it through, but thank God it was not serious, but it could have been. So yeah, there's definitely that, like reliance on other things. Another thing that I did want to say is like kind of maybe related to language. I think there's something about how we communicate, even in terms of body language. Yeah. Right?
Sure.
So like I remember I was talking to someone and they were saying there was this patient who came in, and she was part of the team or whatever. So they were asking this person whatever. So when the person left or whatever, then apparently like other doctors were like, oh, did you see? Like she was like they said, oh, her eyes were racing. She wasn't looking in the eye. She's being dodgy, right? And then thankfully this person was there and was like, because this is someone I think from, but from our region, right? And the person's like, no, like in our culture, you don't look people in the eye, right? And then they're like, really? Like, yeah, no, you don't look people in the eye, right? So then they were like, oh, okay. But yeah, when it was that, like, they were not believed because they were like,
of course. That's
is she not being truthful? Is there something that she's hiding and stuff like that? So yeah.
So no, that's true. And again, it comes down to that whole, I think the power balance, because you're not going to go in and shame as well. Like, when you go in with just look someone in the eye with, oh, you know what, I have a problem in this area, lapha kubuhlungu, and to look at someone in the eye. So Tina, we were not brought up like that. We're not brought up to, it's something that we've had to learn over time, which know what, it's my 15 minutes. I have your confidence. You're not going to take my business anywhere else. And this is my problem. And, to say that and articulate it in a meaningful and in a way that is going to have impact on the person who you're speaking to, the action. But you're right. Body language is a big thing. You're already speaking in a very meek voice because we're vulnerable. We're carrying a lot of that whole interpersonal discrimination. You're expecting that, maybe I'm not going to be believed. Maybe I will be believed. But yeah, it's an interesting thing.
And then just one more point, like we touched on this when we did the topic on domestic violence. Like I think your immigration status, like we're saying, like with the essay example where like they were now asking for documentation and you couldn't. So even here, like if for some reason, maybe you're so then you be scared to even go any but they're supposed to like treat you and stuff. So, or even like if you're dependent on someone and all that stuff. And again, even like if there's domestic violence and there's that nature of the relationship where you're dependent on that person. So I think, those are not all, but some of the issues I think really are unique to us as immigrants. And I think there's a theme here around things that cause us to maybe, I don't know, have a late diagnosis or seeking care early, right?
Very quickly, how are you, like when you go to, are you able to kind of like, okay, so this is my problem?
I think now
Right?
I
Yeah.
am a little bit. But I remember one time, years back, they used to do this thing in the UK. I think they've now changed it, where you could only go and talk about one issue.
Still the same. People
I
go
think now, to
It's
my
still
one,
the
they're a
same.
bit different.
You
actually.
go there with 3 things, right? And they'll tell you that we'll concentrate on maybe 1 or 2.
Yeah. So I remember I went there and like this doctor, I was like, oh, I've got 2 things. And he was like, it's one. And I was like, but these things may be, I don't know. And you're the doctor. These things may be related,
Linked, yeah.
right? And fast forward, years later, I think it was kind of related that when I then had to go to hospital and had a procedure, whatever, like I looking back, I was like, that could have been treated. But the thing about me, because I used to work at the Financial Ombudsman Service years ago, so I know how to write a complaint. And so this person was like, and he was like, snappy with me. I think there was like some discrimination, but he was like another minority. He was like an Asian doctor, whatever. But he was just, and I remember I was in pain. I went to work, whatever. General Medical Advisory Council.
Wow.
I wrote the email, wrote and said, I've got these were my ailments, what. I don't like how I was spoken to. I was in a vulnerable position. And then I remember the manager of the surgery, like how he like you're part of a trust or however it works, like wrote me a letter. I was like, no, in the first instance, can you please like tell us? And I was just like,
never mind.
There are many things I cannot do in this life, but write a letter of complaint
I can do
and get it resolved.
Well done, sis.
But yeah. So,
but yeah, I guess I guess my ampus, like, if I have a headache, I take painkillers. But I don't really waste time. And I think in the boy is just getting on to, like, if you need an appointment for something, like, it takes such a long time. That's the exhausting thing. And then there's that element as well. We do kind of carry through some things. But it doesn't necessarily make it right. We need to look after ourselves. We need to really prioritize self. And go to the people who are able to help you when you need help.
Yes. So let us wind
down. Yeah, so guys, tell us your experiences. What is it like in